Hello, everybody. Thank you so much for joining us for Ocular Fitness. I am Sharon Franzen. I am an acupuncturist in San Francisco, and I am also an associate clinical representative for Standard Process in San Francisco under Kim Sperry. And I would like to introduce her to you. For those of you who don't know Kim, she is our Northern California rep. She's worked for Standard Process for many years, and she has always been my go-to for difficult cases, product information. She is just a wealth of knowledge, and she is my backup plan when I don't really know the answer to a question. So please help me welcome our host, Kim Sperry.
Thank you so very much, Sharon. I may be a wealth of information for Standard Process and MediHerb, but I'm still learning technology. So thank you for sharing with me.
Oh, and sorry, I didn't mention this before, but if any of you have questions during the presentation, please type them into the chat, and we have a little bit of extra time at the end to answer all your questions. All right, so just tap them in there and we will get to them. All right, thanks.
Okay, and then I wanted to acknowledge you, Sharon, because you're the one who came up with the idea of head-to-toe fitness. So we've already gone through brain, and now we're going to be talking about the eyes specifically today. So with that being said, this is all about ocular fitness with the best eye and vision nutrition. And I did want to say that this is not necessarily the opinion of Standard Process or MediHerb, and these statements have not necessarily been approved by the FDA, but I will tell you that I put a tremendous amount of time and effort into my own clinical research, and I stand behind everything that I say today. So I think you'll all be pleased with the information. So we want to look at not just specific nutrition for the eyes, but I want to give you an overarching view of ocular fitness. But I'm hoping that you'll find that at the end of today's discussion, that these 4 products that I'll be concentrating on will not only give you specific support for the eyes, but also the overarching view. And that is other areas that we're going to address is the brain, cranial nervous system, diabetes, medications, and how to manage ocular side effects, and then blue light assault. So let's see. Okay, yay. So just want to go through these products again. It's Standard Process iPlex, Standard Process black currant seed oil capsules, MediHerb bilberry, and believe it or not, MediHerb coleus forte. This has never been taught, to my knowledge, for the use of eyes, and it's fantastic for the eyes. And I'll go through each one in detail. So going back, so first of all, the overarching view of our eye should include the brain and cranial nerves, because our visual system is a combination of our eyes and our nervous system, our central nervous system. The average eye has nearly 1 billion parts. And I thought that, that was fascinating alone, 1 billion parts in a little tiny eyeball. But the fact that our eyes, for their size, have a greater blood and nerve supply than most other organ systems in the body. And I think this is critical too, that nearly half of our brain's cranial nerves are just for the eyes. So when we're thinking about the eyes, be sure and think about blood and nerve supply in addition to eye support. So the first product that I mentioned is Standard Process iPlex. And Standard Process iPlex is a combination of different products that we have. It's a combination of a product that we have separately called Cataplex A, Cataplex AC, Cataplex G, and this is where the nervous system support comes in. Cyruta, which is going to be a very important source of bioflavonoids, including rutin. ostrophin PMG, phosphode, and oculotrophin protomorphogen. So what iPlex will do is it supports the healthy cellular and connective tissue of the eye, which is going to include the collagen that forms the cornea. And again, remember that the eyes are part of the nervous system, so it's important that when you take an eye product, that it is going to support the nervous system as well, which iPlex will do in the form of the Cataplex G. And I'm giving you some of the basics on these products. If you ever need any more information, please feel free to reach out to me or Sharon or Donna. Here's what patients have to say about standard process iPlex. I've been using this product for over 20 years and it keeps my eyesight from depreciating. The times I've stopped using it, from the times that I have stopped using it, the first change that I notice is floaters return to my vision. I thought that was interesting. Suggested use is 6 daily. And here's another one that a patient had to say. So iPlex, just so you know, is not only good for humans, but it can be used for animals as well. And here's a patient review who said, my holistic vet recommended this product when my boxer had her 3rd corneal ulcer. I've had all of our dogs on the product as they age, and they've all developed different eye issues. She said one had a stint with Horner's syndrome. And I looked up Horner's syndrome, and this affects the sympathetic nervous system portion of the eye. And it results in constricted pupils, it results in drooping eyelids, multiple symptoms. And so here she said, I can't definitely say that this is the reason why our boxer hasn't had any more corneal ulcers, but I do believe it's assisting. We haven't had any eye issues with our dogs in over a year. So highly recommend iPlex. The second product that I learned about, black currant seed oil, again, has been a product that we've had for many years. It's an excellent product, but I never thought of it as used for the eyes until I did my own research on this. And this would apply not only for the black currant seed oil, but also the Medi-Herb evening primrose oil. So traditionally, it's been used for treating symptoms of menopause. It's been used for PMS, painful periods, and breast tenderness. It's also used for boosting immunity. I remember one of our speakers, she used to say that black currant seed oil is our breast friend. So it's classically been used for breast tenderness. So I wanted to just give you kind of an overarching view of what black currant seed oil can be used for in addition to eye health. And what makes it distinct is 2 different properties. So one, it's a berry, and black, purple, or red, it's going to be rich in anthocyanins. And this is going to be really important when you're dealing with ocular pressure. So with glaucoma, ocular pressure is increased, and you certainly don't want that. So the black currant seed oil will lower ocular pressure, but it also has the ability to pass the blood-brain barrier. And that's going to be really important to help fight oxidation and inflammation. And the second thing, and this is going to apply to the evening primrose oil as well, is that it's considered a therapeutic seed. And so what that means in traditional Chinese medicine is the seed is considered the powerhouse or the reproductive organ of an herb. And it possesses important medicinal properties that are often used as a component in modern day pharmaceutical products. Again, black currant seed oil is a source of gamma-linoleic acid. So not only does it lower ocular pressures we've just talked about, but it reduces eye strain. In a Japanese study, participants worked at a computer for 2 hours, and the group that were on the black currant seed oil noticed an improvement in visual acuity, improved better focus, and less time to adapt from dark to light. They also didn't experience the back and neck stiffness and eye fatigue so common to working at a computer. Dry eyes, so the gamma-linoleic acid that's found in either the black currant seed oil or the Mediherb evening primrose oil is also going to be good for dry eyes that are associated with a fatty acid deficiency. And here we go regarding the nervous system. Remember that our visual system is a combination of our eyes and the nervous system. And gamma-linoleic acid has been studied for myelin sheath repair, which is amazing. And they found that the evening primrose oil treated group developed faster than the control group. In conclusion, evening primrose oil supplementation, and this would also apply to black currant seed oil, may be beneficial as a therapeutic option for disturbances of nerve interaction. And certainly good for myelin sheath repair, but great for the nervous system in general. Again, black currant, along with rutin, which is found in eye-plex, and rutin is naturally occurring in the cyruta. I mentioned that was one of the products, a special formula that's found in eye-plex. It strengthens the structure of the tiny blood vessels in the eyes. So again, our eyes, as we talked about it earlier, 50% of our cranial nerves go to the eyes, and our eyes depend on blood circulation. Very, very important point to remember. Several studies focus on the therapeutic potential of black currants, also regarding hypertension and other cardiovascular associated illnesses. Neoplastic, so that has to do with cancer or tumors, neurodegenerative and ocular diseases, kidney stones, and diabetic neuropathy. So remember, diabetes also affects our eyes, and black currant seed oil is also beneficial for those that are diabetic. Here's a study in the Journal of Ocular Pharmacology and Therapeutics. The anthocyanins in black currant significantly decreased ocular pressure, a common cause of glaucoma, in just 2 weeks. So it not only works, but it works really quickly. Our black currant seed oil is cold processed. Remember, any oil, especially if it's exposed to oxygen, is going to go rancid really quickly. So you never want to do that. That's why it's critical to have really good quality oils in whatever form of oil that you're taking, whether it's a black currant seed oil or a fish oil. Very, very important to have cold processed oil. And all of our oils are that way. So this is a cold processed. We've removed the oxygen with a nitrogen flush. Testing is done to ensure that there is 0 or no oxidation levels in the oil before it's released. All of the products that I'm mentioning today are already considered generally recognized as safe, can be used with most people that are on medications. Also, with even pregnancy and lactation, these are usually considered safe. And if you have any specific questions, again, please feel free to reach out in the chat box or to me personally, and I'll be happy to respond to that as well. The third product that I want to go through in detail is Mediherb bilberry. So bilberry is one that most of you probably are already familiar with. It's a European blueberry. It was studied, I think, in World War II. The fighter pilots found that they're eating the European jam on their toast actually increased their night vision. But I mean, there's a long history of use, and that's another reason why I chose these particular herbs. They've been around for hundreds of years. They've survived the test of time. They're very versatile and very sturdy herbs, and this is no different. So again, it's generally recognized as safe. It's not even discouraged during pregnancy. You could check with your doctor if you're on a blood thinner. You could just let them know, hey, I'm interested in increasing my blueberry use. Will that be an issue? There's a long history of use for edema, for colitis, for acute or chronic diarrhea, for irritable bowel disease, hemorrhoids, varicose veins, glaucoma, macular degeneration, and cataracts. So it's an amazing product. Now, this is something that I want to show. This is the true differentiation between MediHerb and most other bilberries that are on the market, and this is critical. So I want to read this. It says, it's understood among the true professionals that the majority of bilberry products are either inferior quality or pumped up with food dyes that are considered unfit for human consumption. Then I'm going to prove that to you. The most common method of testing for color herbs such as bilberry and St. John's wort is testing for color instead of what MediHerb uses. It's called HPLC for short, or high performance liquid chromatography. And what this does is it analyzes, separates, and identifies each element in the herb that's being tested, because they want to make sure, and bilberry is no exception. So they also test for the anthocyanin, but also potential toxins, which is very common in the herbal industry. And here, this you'll find in your MediHerb catalog. If you don't have your combined MediHerb and standard process catalog, it looks like this. And you can ask in your next order for standard process to mail one to you, and they'll be happy to do that. You should also be able to, on standardprocess.com, just type in the search function bilberry, and you'll find the bilberry quality story. But I thought this was really important to go through because they were given bilberry and they said something is different about this one. It doesn't look quite right. And when they used the normal method of testing, they found that it was 25%, which is what was claimed by the manufacturers. But when they used this HPLC, and I will tell you that very few companies, if any, other than MediHerb uses it because it's very expensive. But when they used their high performance liquid chromatography, they said one extract only contained 9% of anthocyanins and not the 25%. What they did find instead was an amaranth dye. And it's not amaranth green. This is an amaranth dye that in 1976 was banned from the United States. The FDA said it caused cancer. So here we ship them off to different countries. And then, unfortunately, if you don't have a reputable company, they end up putting it in a product such as bilberry that's supposed to be good for your eyes and is causing cancer. So be very, very careful. If you're not using bilberry by MediHerb, find out how they're getting it tested. That's critical. Okay, the other important thing is, again, the anthocyanins. So we've talked about that. It passes through. So the anthocyanins, just to repeat, are going to be in not only the bilberry, but also the black currant. They pass the blood-brain barrier, but also the blood-retinal barrier, which gives them the ability to fight inflammatory damage, strengthen blood vessels, and benefit brain function and prevent oxidative damage. can be used for dry eyes. So we also mentioned that the black currant seed oil could be used for that, or the gamma-linoleic acid found in the evening primrose oil by MediHerb can also be used for dry eyes. Very good for night vision. Again, source of anthocyanins, so it's going to reduce the ocular blood pressure. Very good for glaucoma. Ginkgo is another source. Oh, got duplicates in there. Okay, so this is another herb that I was so surprised. So I talked about black currant, never thought of it in relationship to the eyes, but Coleus forte for sure was one that I had never thought of for the eyes. Traditionally, it's used for weight loss, it's used for muscle building, hypothyroidism, and asthma. And here's why. So the active ingredient Coleus forte by MediHerb is forskolin. And it works in a way similar to conventional asthma drugs by boosting the levels of a compound called cyclic AMP, which allows the muscles around the bronchial tubes to relax, making breathing easier. So first of all, I'm going to give you the traditional use for Coleus, and then I'll show you how it's used specifically for the eyes. Okay. Also very good for congestive cardiomyopathy, which can cause heart failure. In a small study, patients who took forskolin through an IV showed improved heart function. Again, all of this is clinically referenced. The forskolin, this I thought that was interesting. I found that this morning, mimics the effect of thyroid stimulating hormone in regard to iodide uptake. So this is, Coleus is a member of the mint family, and it can be used for thyroid issues. It does not contain iodine, but it does help the body's assimilation of iodine, which I think is important. And that's done through an increase in the expression of sodium iodine symporters. Here we go, and this is how it works for the eyes. For this, so the forskolin that's in the Coleus forte, along with the rich source of rutin that's found in the eyeplex, when given through an oral route, so just taken orally, appears to reach the ocular district where they can act in synergy. This was a medical study that was done in conjunction with ocular pharmacological treatments, and they found it helped control the intraocular pressure, especially important for glaucoma. So just so you know, this was not done with specific standard process products, but it was with forskolin. And again, MediHerb uses the clinical potencies found in all clinical studies. Here's another clinical study, again, showing Coleus forte can also reduce ocular pressure. So this said forskolin together with homotaurine, L-carnosine, and folic acid reduced fluid pressure inside of the eye and improved eye nerve activity in a clinical trial on 22 people with glaucoma. Similarly, injections with the same compounds prevented nerve cell death in rats with injuries in the blood vessels, the eye blood vessels. And remember, the overarching view of our eyes health is not just specific eye nutrition, but taking care of the nervous system as well. And Coleus forte, that's one of the reasons why I chose this. This is interesting too, and I'm going to talk about it again, but forskolin may have some role in treating conditions associated with diabetes. It improves cellular insulin response. It also decreases blood sugar levels in rats. Here's a clinical study. Some people say, oh, you have to be careful with Coleus. It may increase cytochrome P450. You have to be careful with blood medications. And that's true It's generally recognized as safe, and in the doses typically used in the clinical trials, forskolin is considered safe. So that's 100 to 250 milligrams twice a day. And we'll talk about the potency of the Meteor Coleus forte as well. Actually, it's right here. It's 2 to 3 tablets daily of the Coleus forte is what's recommended. So the side effects of using Coleus forte are very mild. So again, looking at the overarching view of Ocular Fitness, we've talked about specific eye nutrition, and then we're going to address brain cranial nerves, which we've done to an extent. We've discussed diabetes to an extent. We're also going to talk about medications and how those cause ocular side effects. Ocular hypertension, we've talked about that in detail already. And then we'll briefly touch on blue light assault. And again, we've talked about this, so I'm going to move on. This is really important. Know your patient's history. So with any eye issue, rule out all potential nervous system brain trauma first. So concussions, including chemical concussions. So this can be a drug or alcohol-induced concussion. Loss of consciousness, encephalitis, which is a virus that attacks the brain, birth or childhood trauma. And last week when I did my webinar on brain, someone brought up, what about children that are born to drug-addicted parents? I thought that was a fascinating point. And I think in the next slide, yes. So I added this slide because I thought that was critical. And if you're on the webinar today, thank you so much for bringing that to my attention. So here it's showing that, again, you need to really, you can't just ask them, did you have a head injury? If they were exposed as a fetus to drugs, it's going to affect the architecture of the brain. And those are just other ways that the brain or the cranial nerves can be damaged. It can be injuries, tumors, inflammation, infections such as shingles, and inadequate blood supply that occurs in diabetes. So just briefly, and if you want detailed information on neurotrophin, I do have a brain webinar that I've recorded. I'd be happy to email you the link. We'll put it up on my website once my website is up as well. Neurotrophin PMG. So I'm briefly going to touch on neurotrophin PMG and also neuroplex. Neurotrophin PMG is something that I took from my traumatic brain injury. Very important for all brain trauma, sluggish thought, brain disorder, loss of memory. Neuroplex is going to be especially suitable not only for traumatic brain injury, but also neuropathy, seizures, epilepsy, and stroke. So either one of these two are going to be excellent for the nervous system. RNA. RNA is a favorite of mine. I take that with me whenever I'm driving, and I'll explain that in just a few minutes as to why I do that. The RNA is found in every cell of our body. It's found in multiple fluids, including our blood, urine, tears, our cerebral spinal fluid, breast milk, amniotic fluid, and seminal fluid. Traditional Chinese medicine has used placenta as a rich source of RNA because it contains the blueprint for cellular renewal and reduces the effects of cellular damage. Again, that's going back to nervous system health. Ours is not coming from placenta. I'll talk about that too. This is just a brief study showing how RNA is expressed in the body after nerve injury damage, and RNA can be used to help protect and repair the myelin sheath. That's just more of the same study. I thought this was interesting. I didn't realize this until I looked up patient reviews on RNA, and RNA gets just almost 5 stars. I thought that was really cool. I didn't realize it could be used for sleep apnea. So it says, I'm taking 5 a day, 1 with each meal. At first I started with 1 a day and slowly incremented it to 5 a day. You can do that. I take up to 20 a day when I'm driving, and I'll explain why in a minute. I noticed improvement, so I will continue it for 6 months. I hope one day I won't have to use a CP machine in my house. So that was a pretty significant and great patient review. I never thought of RNA for sleep, but there are multiple patient reviews on sleep. Here's where our RNA comes from. So it's Germany. It's German. It's considered the very best RNA in the world. I believe we were the very first company to come out with it. Contains the blueprint for cellular renewal and reduces the effects of cellular damage. This is why I take RNA when I am traveling. It's used for the brain's confused systems of movement. So excess driving and flying is considered a stress to the cerebellum, and RNA is excellent for that. If you're on computers for long periods of time, it's also very good for that. That's more than likely going to help with the blue light assault that we'll talk about. Again, it heals and restructures the organization of damaged brain tissue, promotes tissue healing, and I think of it as a vegetarian option to any protomorphogen. Lastly, I want to talk about black cumin seed. Actually, I shouldn't say lastly because I've got more. Very important for brain health, specific for addictions as well. Allergies, autoimmune disease, especially great for Hashimoto's. Histamine intolerance. So this is now being observed as a key indicator for all female issues, including excessive bleeding, painful periods, and PMS. This would be a very powerful combination to use in addition to standard process Antranex if you are dealing with histamine intolerance. And in this particular case, excellent for nervous system degeneration and toxicity. Neuroprotective effect, cholinergic modulation. It actually increases acetylcholine and GABA. The main ingredients in the seed, so again, this is another seed. Remember, it's the powerhouse of a plant, is the thymoquinone, and that is where all the clinical studies are being done. The oil, the black cumin seed oil or the Nigella oil will not work the same as the seeds. You do need the seeds. And I thought this was interesting too, 5 milligrams once daily for 14 days for neuropathic pain. Again, here the seed is considered superior to all oil versions of Nigella. And there are no allergic reactions with the seed, or very few as compared to the oil. And again, this is important. This is what distinguishes MediHerb from all other companies that are out there. We use ethanol extract or ethanol alcohol to extract the main ingredients from all of the herbs. The most common extractions, but they're less expensive, are methanol and hexane. Those are toxic and they're flammable. We do not use those. Typical amounts in studies is usually just 1 tablet daily. So it's a very potent product and very little is needed. Okay, just a quick overview on diabetes. When I finally get to a webinar on the pancreas, I'll go through this in much more detail. But again, remember that diabetes damages the small blood vessels that feed the cranial nerves. Very important. If one has diabetes, you've got to get that taken care of to protect your eyes. Because diabetic retinopathy It's caused by high levels of sugar that damage the eye vessels, results in blood leaking into the eye and damaging the vision. Here again, Coleus forte is going to be excellent for diabetics, but also diabetics that are having issues with their eyes. It says it blocks two proteins responsible for glucose transport, the GLUT1 and the GLUT4, thus potentially helping to decrease blood sugar levels. Also used to reduce sweet cravings. Inositol, 500 milligrams twice daily, given to 7 diabetic patients for 2 weeks, increased the amplitude of the nerves. Very important to get your nerves actually working faster, okay? By an average of 76, 160, and 40% respectively. It may be very valuable in the treatment of diabetic neuropathy. This was a study on pregnant women. Again, as I'd mentioned, all of the products that I'm mentioning today are generally recognized as safe. They were giving inositol to pregnant women that had gestational diabetes. This was a 2-year study, and they were given 2,000 milligrams or 2 grams of the inositol twice daily. Incidence of the gestational diabetes was significantly reduced in the inositol compared to the placebo group. Conclusion: inositol supplementation in pregnant women with a family history of type 2 diabetes may reduce the incidence and delivery of macrosomia fetuses. Very, very important product. Standard process inositol powder, I've already done the math for you. So 1/4 teaspoon is 700 milligrams of the powder. So you would need actually 1 teaspoon twice daily to match the amount that was done in the clinical studies. It's recognized as safe. Up to 6 teaspoons a day can be used. I put for anxiety because it's been used for a lot of different things, including nerve pain and nerve damage, but also very good for anxiety. As if you wanted to use the chewable tablets, I'd recommend 5 tablets twice daily to match the clinical study. So we've already talked about Coleus forte, we've talked about inositol and black cumin. Just a few other herbs that can be used for regulating blood sugar are listed here, including fiber. Don't forget, fiber is really important for managing blood sugar. Okay, really important. The medications that most often cause ocular side effects are those for osteoporosis, erectile dysfunction, hypertension, and prostate conditions. Much more, but those are the main drugs. This is a great little website. It's called Mytavin, so mytavin.com. You can type in any medication and it will calculate the nutritional deficiencies being caused by this medication. And again, we talked about ocular hypertension. This is just showing how blood pressure may change relative to the eye pressure. So Coleus forte, medi-herb bilberry, the medi-herb evening primrose oil and standard process black currant seed oil all will reduce ocular eye pressure. And the AC carbamide is one that also can be used. Here's just a brief, I thought this was really cool. Again, this was a doctor's review. 78 out of every 10 people, AC carbamide combined with iPlex. Again, iPlex is going to be one of my favorites. It's going to be one of the first that I recommend. Helps bring eye pressure back to normal. The longer you've been on kidney damaging drugs, the worse your kidney damage, the longer it will take to lower your eye pressure. You can use grapeseed found in Vitaminox. That is going to also reduce the eye pressure. It's an antioxidant. Again, we've talked about how important it is to cross the blood-brain barrier and to help reduce that inflammation. Here's a Korean study showing that grapeseed extracts protects the nerve cells related to the retina. Important for macular degeneration. And lastly, I want to talk about blue light assault. Normally, whenever I'm on the computer, I'm wearing these, okay? Very important when you consider how often we're on our smartphones, and nowadays it's kids with video games, television, computers, that blue light, very important. And I found on Shark Tank, it's called Gunner, and you buy this at the game store, which makes sense for gaming, but it's a great little blue light blocker glass. So that's what I like. And they're pretty reasonable. They're about $40 to $50. And this just goes into more detail about blue light. It's considered slow poison. Some of the common symptoms, again, are eye strain, headaches, blurred vision, eye irritation. Remember, black currant seed oil can also be used to help negate some of those effects. Black currant seed oil and inositol can also be very good. RNA, and that's why I chose these, because they're going to be so important for not just the eyes and the nervous system, but also blue light assault as well. And that is it for me. And I hope you all enjoyed it.
Wow, thank you so much, Kim. That was a lot of information. I mean, I've done this with you before and I still have notes. We do have a couple of questions.
Okay.
So Jennifer would like to know if you recommend taking black cumin seed in the AM or before bed. Do you have a preference?
I don't see it being an issue one way or another. My recommendation, Jennifer, is to go ahead and try it either way and see what works best for you. Did you have a specific issue regarding whether to take it in the morning or evening?
No, I just wondered because
Oh, Jen, hi.
hi.
I didn't realize it was you. Hi.
Yeah. I just didn't know, because it's only once a day, sometimes there's strategies for AM and PM. And I just wondered, with it being a resting thing and replenishing thing, my gut feeling would be that it'd be better to take it at night.
Yeah, you could try it. I don't think it would be an issue. I will say I talked about black cumin seed in much more detail in my brain webinar. Very important for neurodegeneration, including Parkinson's disease. Okay. And based on how severe the nervous system degeneration is, you may need to take more, but for most people, just one. And I take one black cumin seed a day too.
One other question I had is how many months on the protocol? Like this protocol, if you have a client, how many months before you would see any improvement?
Well, it depends on what you're taking it for. Do you have something specifically in mind regarding?
We're all suffering postmenopausal women with dry eye.
Oh, my recommendation is to take it ongoing. I would just take one of the black cumin seed daily because it's got so much benefit.
I'm talking about the iPlex.
Oh, I'm sorry. I thought you were talking about
the whole protocol,
seed oil.
Like the iPlex with the, if you're doing a trial, like you're going to go through and do it. Do your
the way I was taught, it takes about 3 months to establish really good tissue. My recommendation is to give it 3 months.
Okay, great. Thank you.
You're welcome. Thanks for being on the call.
Loved it.
Thank you.
We also have a question from Shelley, and this, I'm glad you asked this, Shelley, because I had this on my mind as well. After cataract surgery, it's common to have floaters. What combo of supplements would you recommend for that? Anything different, Kim?
I would probably recommend, and Shelley, I know who you are. I've got your email address. If you'd like, I can email you my post-surgery suggestions. And that's probably another webinar all on its own. But I would look at Gotu-Kola complex. I think that's really important. That's not necessarily for the eyes. but for specific eye surgery, so keep in mind that surgery greatly increases your need for protein. So I'd make sure that you're taking a really good protein source, like Whey Pro Complete. You could use the Veggie Pro, would also be important pre and post surgery. And then as far as what kind of eye surgery?
Cataract.
Cataract surgery. I would probably start, the basics would be on, I would start definitely on the iPlex and blackcurrant seed oil. And I'd recommend 6 of each a day. And please let me know if that meets your needs or if I need to follow up with an email.
Wow, great. Any other questions? While you have Kim at your disposal?
Unrelated question. You just talked about the whey protein as a protein supplement. So I wonder what the difference between the standard whey protein and the detox whey protein is.
Oh, okay. That's a really good question. So the Whey Pro is a whey protein. The SP Detox Balance, is that what you're talking about?
Yes,
Or are you talking
yes.
about the Veggie Pro?
No, the detox balance.
Okay. So the Detox Balance is something that can also be used before and after surgery. Talk about, that's probably one of the biggest things that I recommend before surgery to speed up your healing process before surgery is to do a detoxification, whether it's the SP Detox Balance or the 21-day purification program. And for those of you that aren't familiar, we are in January. Stay tuned because Standard Process is doing a national detox program for either the 21-day program or the SP Detox Balance. And so the SP Detox Balance is a pea and pumpkin protein instead of a whey protein. And we're doing that for anyone who's sensitive to whey. It just gives them another option. So you could use either one.
Okay.
Both would be excellent. And what differentiates our company from a lot of the others that are out there is we use a non-denatured protein. Everything is cold processed, so you're getting the full amino acid profile. Cooked protein, you end up losing so much of the amino acids, and that's critical information.
So I have a related question. The 10-day inflammation cleanse as opposed to the 21-day purification, what's the difference?
That's what I can do is I can email that to you.
Okay, great.
Those are different products. You're welcome, Madhu. I would, personally, the 21-day purification program would be best. That's the gold standard. I always recommend that first and foremost. The 10-day inflammation is in kind of an introduction and can't be used as an alternative if someone isn't willing to purify or detox for 21 days.
Yeah, because I did the 21-day purification a while ago, and I think that I wasn't able to, after 10, 15 days, I felt like I was getting spots on my face. So I wasn't clearing out, the various detox pathways, right?
And that's critical. So if you ever have any kind of a detox reaction, that's a really good indication that additional detox is necessary. So yeah, I would definitely do another detox. And the SP Detox Balance is another very gentle way. That's something that I take every single day. I just take one shake of the Detox Balance a day.
Oh, so you can use it every day.
You can use it every day. Yeah, it's a very gentle detox.
Okay.
Just one daily.
So for the 21-day, that might be better for me since I had, issues from the last one. It's more gentle.
You mean the
right?
SP Detox? Yes, I would do the SP Detox Balance. So, it originally came in chai flavor and it still does, but I prefer the plain
Okay.
SP Detox Balance.
Great. Thank you so much.
Oh, you're so welcome.
Yeah. Sharon, you were going to say something about the detox, right?
Yes, I didn't want to make a great diversion into the detox protocols,
Yes.
but you know, oftentimes I'll tell my patients that they may have things like skin issues come up during a cleanse, and that's, you know, if there's stuff that needs to come out, you know, the skin is sort of one of those places, right? I mean, it's not fun, but it does
Yeah.
tell you that I think that something's working.
Mm-hmm.
Even if
Right.
it's not pleasant, it's
But
still,
then it doesn't clear out after that, right? It
well,
stays on
yeah,
my
then, yeah,
face.
right. And like Kim said, then you need further
Yeah.
work.
So I think I'll do the detox balance. That might be
Yeah,
gentler for
just
me.
do one shake a day would be perfect.
Yes. Okay, great. Thank you so much.
You're so very welcome.
And the ones that help cataract prevention or cataracts, I made some notes about, because I have a cataract. And
And you know, I'm sorry, go ahead.
so I was wondering if this is at the beginning stages of a cataract or if it's somewhat developed. That's my question. Like
I have zero access to my computer because I'm in full screen. But
Okay.
what I can do is I can follow up with you in an email on
Okay,
all the other products that are used for cataracts.
excellent. Thank you
Okay.
so much, Kim.
You are
Yeah,
so very welcome.
thanks.
Kim, this is Jennifer Klein. Hey,
Hi, Jen.
can you also send me that information about cataracts?
Sure.
Or maybe everybody in the group wants, everyone that signed up, I don't know, just putting it out there. And the only other thing is, would you send the webinar on neurotrophin?
The link for the brain
Yeah.
webinar. And
Yes.
yes, and I don't have my notepad with me either. But
Do you want me to email you?
yes, please.
Okay.
If you two would please email me and just tell me what your requests are. All of you, if you've got requests, just email me. So my email is right there, ksperry01@standardprocess.com. Just want to say, if anybody ever tried me at kim@spnatural.com and never heard back, that's because I've had zero access to that since December of last year. So please get rid of that old email and only email me at ksperry01@standardprocess.com. And I promise I will follow